Dr. Jeremy Alland, a sports medicine doctor at Midwest Orthopaedics at Rush and the team doctor for the Bulls, joins us now to walk us through what may have happened to Hamlin. Thank you so much for being here. It was so tough to watch that. We see the blow from the helmet, that trauma right to the chest. What happens to the heart in that instance?
Yeah, it definitely was very shocking for people. I think we're used to seeing, ambulances or sometimes come out or people being carted off, but certainly the length of time and the amount of commercial breaks was very, very chilling for people. But, when you take a direct trauma to the heart, it can get a bruise almost like anything else in the body. And so, our heart is mostly electricity. And if it gets hit right at that perfect moment, it can actually cause the electricity to go haywire and the heart to stop beating. And so, there's a condition called commotio cordis, and this is just speculation. We obviously don't have information exactly on what happened, but it's a common condition in which, it's actually a rare condition, but it does happen with direct trauma to the chest. Can cause the heart to stop beating.
I know a lot of people were confused because at first he stood up, he adjusted his helmet, and then collapsed. What's going on in the body at that time?
Yeah, it's a really good observation, because actually that's classic for that condition, is to get hit and actually stand up and look okay, and then to pass out and fall over it. So in reality, what's happening is that the heart is still able to perfuse the brain or get enough blood to the brain for a short period of time, and then certainly is not contracting enough to get enough blood up there, so then you lose consciousness.
Doctor, even if the heart is stopped, we know that people were performing CPR on him. I don't know if it was chest compressions and breaths, but is he able to still get oxygen and blood to the brain while someone is performing CPR?
It's an excellent point, because I know that one of the things that we really try to emphasize is early CPR, early compressions, is the most important thing in this situation. And so we know it doesn't replace a full functioning beating heart the way you'd want it to, but certainly getting early good CPR with compressions can definitely increase perfusion quite a bit.
And I know it took some time. He was getting the compressions first, and then there was an AED. Are they equal in terms of getting that rhythm back in the heart?
With a young person, the AED is definitely the most important. We really try to separate out somebody who has cardiac arrest versus somebody who has cardiac like heart attacks, because a lot of times these hearts are healthy. They don't have a lot of plaque buildup or cardiac disease, and so most of the time there's some rhythm that can be shocked out of it, which is why you've seen maybe AEDs put around schools and around a lot of athletes and things like that, is to get that AED on right away. But if you're approaching a body and they don't have a pulse, you got to start the compressions until you can get the AED out there.
Right, and that's why I want to go through a couple of things as a professional team doctor from you. Do they have heart checks before starting to play? Do we know that the heart is healthy?
Yeah, every league has different requirements, and so that would be up to the NFL and their requirements. Many professional athletes do get their heart checked quite a bit, and again, it would vary by the league, and I actually am not familiar with the NFL standards on that as far as what they do for every player, but most of the time they feel pretty confident. They all get physicals, so you definitely know that they had their heart checked at some point.
Okay. For the Bulls, I mean, he was immediately surrounding getting help. Is there a doctor on the sidelines? Are there people who know CPR?
Yeah, so maybe the best place to have this happen is actually at a sporting event, a professional sporting event, because you're going to have lots of doctors. There's EMTs. You saw the ambulance out there. There's athletic trainers, and so in reality, before every season, so with the Bulls or with every organization, we go through what's called an emergency action plan, an EAP, and so we actually simulate these things before the season starts and every season, and sometimes even in between the season, just to make sure that we know what to do. And it certainly looked like they got out there very quickly and we're on him as fast as possible, which is the most important thing.
How close typically is an AED? We saw the ambulance come, and I know he was given the defibrillator inside the ambulance. Is there one on the field somewhere?
Yeah, so usually both sidelines will have one. I know that in, again, in the NBA, we have one with our athletic trainer that's outside, but then the EMS has one. So they're very, very close by.
I know there are athletes who have survived this, and so many of us want to have hope. Can you talk about that?
Yeah, I mean, I think that a lot of young people can survive this, again, because there's not a lot of buildup or issues with the heart before the injury itself. And so, the hope is that because he had early compressions and had such a great care in terms of getting everything done really, really fast and got a heartbeat back, that he can survive. It certainly is going to require some monitoring in the hospital and a prolonged recovery probably. But, it's hard to speculate on how long it took to get the pulse back, because they didn't comment on that. But certainly being young and healthy and fit is certainly going to play in his favor.
All right. Thank you so much, Dr. Jeremy Alland. We appreciate your insight today.